My first volunteer experiences were when I was a child playing the violin in retirement homes. I could see how much I was affecting these wonderful elderly people who were there listening to my music, and they would be smiling, singing along, tapping on their wheelchair, and it really made me feel really good inside to know that I was helping these women and these men have a better day. As a college student, I organized a lot of philanthropic events as social chairman for my Tri-Delt sorority, benefiting the St. Jude Children's Research Hospital. We planned afternoon tea in the Rodin Gardens at Stanford, as well as had wonderful pansy breakfasts. We sold t-shirts. We helped with various events on campus at Stanford to benefit these children that were in need. There was really no single moment that led to a career in philanthropy. I always enjoyed taking care of patients and taking care of people, and that led me into a career of medicine specializing in breast cancer diagnosis. That specific career was really influenced by the fact that 3 generations of my family had undergone breast cancer diagnoses and treatment, and I recognized that I could make a difference beyond just diagnosing breast cancer. We could actually provide technologically electronic access to prior imaging for comparisons that are essential in the early diagnosis of breast cancer, as well as reducing the unnecessary additional imaging. In that way, I formed the company Mammosphere and formed it as a nonprofit organization because I realized that this was an essential service to women, and we really needed to provide this information in order to have the best, earliest cancer diagnosis. My mother has had the most significant impact on my life in influencing my pursuit of music and academics, but my grandmother has had the most positive impact in my life. She was the kindest and most caring person I've ever met, and in her life of having an early diagnosis of breast cancer, I saw with my own eyes how much she was affected, both psychologically and physically. And so this led to my pursuit of my career in early breast cancer diagnosis and hoping that women would not have to endure what she did. I don't really view this as giving back or paying it forward. I look at this as doing what God put me on this earth to do. He surrounded me with 3 generations of women who were all affected by breast cancer, and so I was highly influenced into pursuing that career and helping other women not have to undergo what my family members did and making it easier.